no clue what could be the possible cause of his presenting complaint. So the history will give you some clues, but the examination will review most of the things. Almost always, your diagnosis will clear on examination. The first step on examination is inspection. First of all, do not rush to touch the mannequin. Just look on inspection. Okay? So we're going to begin with the normal one. So this here is the normal one. Okay? And we're going to start first with inspection. What are you looking for in inspection? We're going to first of all be looking for normal anatomical structures. The first and obvious is to look at the testes. Okay? Now, before you perform an examination, you need to make sure that you wear the gloves. Okay? So I'm going to wear gloves now. So, you have to wear the gloves. So wear the gloves now. And we're going to be performing inspection. First, we said to look at the normal anatomical structures. In this mannequin, you can see that the left testis is lower than the right. This is normal anatomical position. The left testis is lower than the right one. This is normal. Okay?
Left is lower
Then have a
than the
look.
right
Is there
one.
a foreskin? In this particular case, yes, there is a foreskin. Okay? The next thing is, are there any obvious masses? Any obvious masses? In this particular mannequin, it's a normal one. I cannot see any obvious masses. Okay? Any skin changes? Okay? Any redness? Any sinuses? There is nothing like that. So, just by inspection, you can get a lot of information. So first of all, perform inspection. I'll repeat again. Perform inspection. Just have a look at the normal structure. You can see that the testis, the left testis should be lower than the right testis. Is there a foreskin? Which means we need to retract the foreskin. Are there any obvious masses? If there are obvious masses, what's the color of those masses? Are there any other obvious pathologies? Okay. Now, how to do an inspection? You need to ask the patient to lift his testes. Okay. So you can examine the patient to begin with, either in lying position, okay, or in standing position. This mannequin here is in standing position. So we're going to be doing inspection in this type, obviously, in standing position. And you can clearly see what we talked about. The left testis being lower than the right. Okay? Good. In this particular mannequin, there is no foreskin. As you can see, both the testes look to be similar sizes. Okay? While in here, we looked at this other one in here. There is a foreskin. There is a foreskin. Both the testes look similar, but again, you can see that the left testis is lower than the right. Okay? So this is on inspection. Any obvious masses or not? Now, if you're going to be doing it in standing position, you have to ask the patient to lift the penis. In this case, the patient himself should lift the penis so you perform proper inspection. Now, inspection, you have to perform anteriorly. You also have to perform inspection posteriorly. So you're going to have to lift the testis and you're going to have to lift the testis so that you can check posteriorly. Okay? Good. Now, I'm going to show on this one. So you're going to have to lift the testis so that you can perform posteriorly. And how you lift the testis is simply like that. Okay? Done. So this is what you do on inspection. The next thing we're going to have to be looking at, obviously, is proper examination itself, testicular examination. Where shall we begin from? We need to palpate for certain things. One, the testis, that both testes are present. The epididymis, okay, that they are present. If there is a foreskin, we have to retract the foreskin. And we have to look for any masses in the testis as well. So from the testicular examination, find the testis, find the epididymis, find if there's any masses, okay? And if there's any other extra, abnormalities that we expect. For example, is it a varicocele? Okay? Then you look for signs of varicocele. Okay? So let's start. How do we do palpation? As I said, we can do palpation either in standing position or lying position. I'm going to show you on this mannequin here, and I'll show you on that mannequin as well. So in this mannequin, what do? I'll start palpation. First, you have to fix the testis. The testis is not moving. So I'm going to put my hands like that, and I'm going to put my hands like that. Then I'm going to be rolling this testis between my thumb and my index finger. Between thumb and index finger. You see? Both thumbs can get involved. But the general rule is rotating the testis between the thumb and the index finger. Okay? So I can feel the testis in here. And I need to go and palpate for them. To feel for them. Epididymis, which I can also palpate in this particular case. Okay? If I want to check the other testes, I can try to fix the testis as well by simply putting my fingers in here and in here, so the testis does not move around. When I do this, it stops moving around. Yeah. So that's the epididymis. I can palpate there on the top. Okay. The rest I can feel between the thumb. This thumb and index finger, you feel around. Okay. So you're more of rolling around, roll the testis between the thumb and the index finger. Okay. What else can we feel for? So there are not any muscles. You feel the testis. When you feel for the muscles, I can't feel any muscles. Are there any varicose veins? You look around in here for the varicose veins. Okay, and then you palpate around in there. How do they feel like? You can palpate here as well. How do they feel like? Feel like a bubble worms. Okay. The next thing we'll be looking at is there is a foreskin. So we need to ask the patient to retract the foreskin. Okay. You can do it, but it's better to ask the patient. In the exam, the patient will be sitting close by, so you ask the patient to retract the foreskin. Okay. So I'm gonna do it in this particular case. I don't have the patient. So you're gonna have to retract the foreskin, but take permission from the patient, or ask him to do it, okay? To make sure that there's no any signs of infection, no any masses, no any signs of cancers there as well. And then when you do that, obviously you have to protract the foreskin back in this particular case, okay? Just 1 second. Yeah, you protract your foreskin back when you finish your examination, okay? That's fine. So this is the normal structure we follow. So let's repeat. When you do examination, don't rush to palpate. Just look. You make it notice simply by inspection. Okay? Is there a foreskin? And the left chest is lower than the right. Are there any obvious muscles? In other obvious pathologies? Have you inspected the posterior and lifted the chest to check the back? Okay? What you can also do during inspection, you can also ask the patient to cough. Can you please cough to see for any coughing pulses? Then our inspection has finished. Then you go for the palpation. You can palpate for the testis, palpate for epididymis, any muscles, any extra pathologies you're expecting, depending on the history. Again, I'll repeat. You'll have to, when I put your fingers, 2 fingers between the 2 testes, and you're palpating this testis, to stop it from moving around, and then you'll be able to palpate properly, feel just the structure of the testis. Yeah, like that, rolling between the thumb and the index finger. Then you have to go in here. You can do the same between the testes, to do like that, and then you palpate like that. Okay. Avoid pricking. Avoid doing like this. It's not proper palpation. For palpation, you should be moving between the thumb and index finger, rolling the testes. Okay. Thank you. So that is the structure. This was completely normal. Okay, so that should be the examination. Thank you. Okay, so now we're going to be looking through different type of pathologies, and we're going to be starting with the varicocele. Okay, so varicocele will be the first one. And again, I'm just going to remind you, what are we supposed to be doing? We're supposed to be doing inspection. Okay, so you can see here in the varicocele that the left testis is lower than the right, okay, which is normal. There is no foreskin in here, okay, no any obvious muscles. After the formal inspection, you need to lift the testis to look posteriorly, okay, then palpation. So take time to look. There's no any obvious swelling of the testis, okay. Now what do I expect in a varicocele? We're expecting varicose veins. So you're gonna look, they usually look bluish in color. So look on this side, you can see a little bit some zigzag of the veins in here. But then you need to compare to the other side to see if it's exactly the same or not. Okay, so there is a little bit of exaggeration in here of the veins, so they're a little bit dilated. But it's difficult on inspection. Palpation, that's why you're supposed to be targeting. So when you palpate in here, you'll feel, that there is some varicose veins, which feels like a bag of worms. You should go and compare. It's just above the testis. Just palpate like that. Just like that. Then you go and do the same in here. You're going to feel very big difference. There is nothing on this side, but it is there in here. Obviously, you're going to do exactly the same thing. Palpate for the testis, any muscles, epididymis, and obviously look for any extra pathologies we're expecting. In this case, if we're expecting varicose veins, then you're going to find them around in here. This is where you're going to be palpating. Okay, above the testis, going up like this. Okay, feels like a bag of worms. You do on this side as well. You do exactly the same, but there is nothing on this side. Your diagnosis is clear. Varicocele. Thank you. Okay, so in this particular case, now varicose veins, usually they would disappear when the patient lies flat. Okay, we said we can examine the patient in a standing position or lying position. So you might need to ask the patient, can I just ask you lie down? What will happen in the exam? The patient will just make the mannequin lie flat like this. So which means the patient is lying down. Okay? Now what you can notice in here usually, because they are the veins, the veins will disappear when the patient is lying down. So you can perform examination standing and lying down at the same time. Thank you. Okay, so the next pathology we'll be looking at is testicular tumor and the perineal cancer. Testicular tumor and the cancer of the penis. So the rest of the step of examination remains the same. On inspection, what do we see? We see the same. The left testis is lower than the right. There is a foreskin. Both testes are similar in size. Any obvious muscles? No obvious muscles. Okay, good. Next inspection, you lift the testis to check on the posterior. Nothing. What else can you ask? Ask the patient to cough. Okay, good. The next, what we're going to be doing upon inspection, we're going to be obviously checking doing palpation of the testis. So let's start some palpation. Okay, so I'm going to ask the patient, if the patient is standing position, you ask the patient to lift his penis so that you can palpate. Okay, so what I'm going to do now in here, I'm going to show the palpation technique one more time. So we said to stop the testis moving around, we're going to be doing that. And then we have to roll the testis between the thumb and the index finger. Okay? We go to the other side, we're going to do the same like that. We're going to do that. We're going to palpate. Now, when I've done this, what you can obviously see in here, you can see that the muscles are becoming obvious. Okay? So when you do that, you can see there are some muscles here becoming obvious. And these muscles are attached to the testis. This is a cystine. This is epididymal. This is epididymis. But in here, what we're feeling in here is the muscles, obviously. So you have to describe the mass. Okay? It's round in shape. It's about 1 centimeter in diameter. You're just feeling it yourself. What's the size? The surface is smooth. In this case, the surface is irregular. It is attached to the testis as well. Okay? See there? It's attached to the testis. Can you get above it? Yes, you can get above it, which means it's not a hernia. Okay? Good. Now, because we felt a mass, we need to check whether this mass does what? Transilluminate. Okay? So, now what you can see in here, this is a touch. I've got a touch, and I've got an illuminoscope. So, where I felt the mass, I have to try to transilluminate. The touch must touch the scrotum where there was a mass, and then you look through. And ideally, you should switch off the light to see if it does transilluminate, and you can check it from different angles. Okay? Good. The patient has got no pain, so we're not going to be doing other things. What's the next thing we're going to be doing? There is a foreskin. We have to inspect. Okay? Okay? We have to inspect. So you're going to have to protract the foreskin. Okay? And we said ideally ask the patient to do it. Oh, what do we see? What do we see in here? We can see that there is there's a swelling there. So this is a cancer of the penis. And therefore, our task is the pathology is testicular tumor and the perineal cancer. So if you do not protect the foreskin, you're not going to be able to see the perineal cancer. Thank you. Okay, so our next pathology would be hydrocele. Okay, so hydrocele is our next pathology. In this particular case, I'm not going to go through all the steps again, but you can see clearly that there is no foreskin. We can see on inspection the left testis is lower than the right. The left testis is lower than the right. Okay? But you can also say, if you lift the testis, that the left testis is bigger than the right. Okay? So we can actually make a diagnosis of inspection and looks like more of a hydrocele. But we have to confirm that when we are doing our palpation, in hydrocele, you're not going to be able to palpate the testis. So that's what we want to confirm, that the scrotum is large as a whole because there's a fluid accumulation and you're not going to be able to palpate the testis. Okay? So you can start from the normal side to feel for the testis. As usual, to stop from the testis moving around, you put 2 fingers in between, and then obviously you roll the testis between your thumb and the index finger. Now, in here, where there is the expected pathology, you can see it's very big. Okay? It's very difficult to palpate the testis. I'm unable to palpate the testis because there's a fluid everywhere. Okay? You see that? There's the fluid everywhere. Okay, good. Now, that is what we're going to be finding in here. What is also important, we need to check for transillumination test. So, again, as we said, we're going to do transillumination. Okay? It's very transilluminating in this particular case. Yeah. So, that is the rest of the things remains the same as usual. Now, the other thing I wanted to show you is how to examine the patient if the patient is in standing position. It is simple. Again, ask the patient to lift the penis, and then you're going to be doing it, like that. Okay? But the patient must lift the penis. Okay? And then you're going to be palpating, like that. And then if you want to do on this side, you're going to come like this, and you do like that. Okay? Good. That is the standing position everywhere else. So that was a hydrocele, not able to palpate the testis, and on inspection, you can see clearly the left testis is swollen and is bigger than the right. Thank you. Okay, so our next pathology we're going to be looking at is the epididymal cyst. Okay? Epididymal cyst. The rest of the procedure, again, as a revision, inspection, don't rush to touch or to palpate. Just have a look. And obvious abnormalities. Let's look. In this particular case, in obvious abnormalities, look around. Okay, if there's any obvious abnormalities, there's nothing. No discharge, no redness, no swellings, any signs of varicose veins, cannot see. A little bit of a lump in there as we can see. Okay, but there's nothing else. Gonna lift the testis. Gonna ask the patient to cough. Okay? So always do this thing. Ask the patient to cough. Yeah? So that is an inspection. Gonna go for the palpation. There is no foreskin. Gonna go for the palpation. As usual, same. So I'm gonna focus only. You're gonna go through all the steps. Palpate the testis, palpate the epididymis. Okay, feel for the masses. Okay, and then off you go. So I'm gonna come in here. The same. If you look away with your fingers to stop the testis moving around, and I'm gonna palpate between the thumb and the index finger, like that. But you have to be very gentle in this particular case. You can feel at the bottom, you can change your fingers like this. Make sure it's between the thumb and the index finger. You can even use 2 fingers in there, but that's how you do it. Like that. You can even do like that. Okay. We come on this side. We do the same. Okay. What you can feel in here there is a cyst. This is the testis. You can see in here, it's a testis. But then there is another mass in here which is palpated separately. So what is important is a epididymal cyst is usually palpated separately from the testis. And here is a mass which is separated from the testis, as you can see, whereas this is a testis itself. The rest of the structures are absolutely fine. Because there is a mass, obviously we have to do transillumination test, okay? And we can get above the mass, meaning it's not a hen. So the main point in here, there is a swelling or there is a lump which is palpated separately from the testis, which is what you find in epididymal cyst. Thank you. Okay, so our next testicular pathology or next indirect inguinal hernia. Same as usual, begin with inspection. So I'm just gonna have a look. So you just have a look in here. Just have a look on inspection. What do we see? So you're gonna ask the patient to lift the testis. But then if you're gonna have a look, you can see there is a swelling here. Looks like a blue, darkish, okay, running here and that. So this swelling is a hernia, okay? This is coming all the way up, yeah? Any obvious masses, yeah? Lift the testis to check posteriorly, okay? You can see the hernia continues all the way posteriorly, okay? No any other obvious findings on inspection. Now, so on palpation, same. You have to check for the testis. Okay. So you check for the testis. This is a cyst here, it's not a so it is a epididymis. Okay. But then you can see clearly this mass in here. So you have to feel this mass. You have to follow it up. Okay. See, I'm following this mass. Can I find where it starts from? No. I can't get above the mass. So it is a hernia. The color is slightly different as well. Okay. The color is slightly different as well because it is a hernia. Like what can I do? What else can I do? I can do transillumination test. Okay. Do transillumination test to see if it's transilluminating or not. So just gonna take my pens. Of course, it's not gonna transilluminate. Yes, it's not transilluminating. If there is pain, in the testis, then you can check for Prinz's sign. What's Prinz's sign? You lift the testis like that. If the pain is worse, it is likely to be testicular torsion. If the pain improves, it's likely to be epididymis. The best way would be patient obviously lifting his penis, asking himself to do it. So when he lifts the testis up like that, if the pain is becoming worse, it is a torsion. If the pain is becoming better when you're lifting, it is likely to be epididymis. Okay? That is if there is pain. In this particular case, a clear hernia, the most important thing for us is to find whether you can get above the mass or not. You can't get above the mass in this particular case. It's bluish in color, as you can see, coming up in there. Okay, good. Now, special examination of the hernia is covered in a different, obviously, video, which I believe you must have already watched. Or if not, then you need to watch the video of teaching inguinal scrotal swelling. Thank you. Okay. Of course, because this is a hernia, usually hernia would contain the bowels, so it's usually advisable that you auscultate the what? Auscultate the hernia. So you're going to have to auscultate. Okay. And of course, a stethoscope needs to be cleaned afterwards. It is a swelling. It needs a transformation test. It needs a cough impulse to be checked, or other tests needs to be done. Okay. Thank you. Okay, so our next pathology is in epididymocarditis. Okay. So epididymocarditis or epididymitis. So what we are seeing in here, clearly in this particular mannequin, grossly the testes are swollen. You can see masses, on the superior part of both of them, which are actually these epididymis. Okay. And now ocarditis, you can see the swelling of both of the testes. Since there are some swellings, ask to cough. Same inspection, lift the testes to check posteriorly. Now, because it is epididymocarditis, patient may present with pain. So which means checking for the Prinz sign is crucial. Okay? Checking for the Prinz sign is crucial. Okay? So what we're going to be doing, special test, Prinz sign, ask the patient to lift the testis. If the pain becomes worse, it is a testicular torsion. If the pain becomes better, it is a epididymocarditis.
It must be said that the specificity for this test, okay, you have to realize this. You have to take with relevant history and everything, then it's useful. Alone, not very useful. You've got things that suggest an STI and epididymocarditis and there's pre-test positive. The history that suggests this and the fact that pre-test positive only means that you're going to want to exclude torsion while suspecting epididymocarditis. It doesn't actually make the diagnosis, you understand, right? It just increases the possibilities of what could be wrong, okay? So if you do end up doing it, and it does become positive, that doesn't mean you exclude epididymocarditis now, okay? Because even an epididymocarditis can have pain, So at the end of the day, with the history, if there's discharge, if there's burning, all of these things, look for these things. Unprotected sexual intercourse history, look for these things. Okay, and then if this is also positive, it just means that's an extra DD you need to rule out. Maybe you need to act more urgently. Yeah, maybe you need to refer to you more urgently to rule out testicular torsion. Okay, so that's what it would mean. Yeah. But anyway,
inspection, leave the testis to check posteriorly. Now, because it is epididymocarditis, patient may present with pain. So, which means checking for the Prain sign is crucial. Okay, checking for the Prain sign is crucial. Okay, so what we're going to be doing? Special test, Prain sign. Ask the patient to lift the testis. If the pain becomes worse, it is a testicular torsion. If the pain becomes better, it is a epididymocarditis. Okay. Next is palpation. What do we expect? We expect the testis to be swollen, not like in hydrocele. Okay? In hydrocele, we are not able to palpate the testis. In this one, we're going to be able to palpate the testis, but the testis will be very, very big and swollen. Okay? As you can see in here, testis is swollen because of inflammation, but you're able to palpate the testis. And obviously, there will be some other, the epididymis, they are also swollen up. As you can see, that's why it's epididymocarditis, inflammation of epididymis, that is epididymitis and ocarditis. Okay? So it will be very clear on inspection itself. It should be backed up with the history. And again, the main thing is that if the testis is swollen, as in general, we are able to palpate the testis, but it is swollen. In a hydrocele, you're not going to be able to palpate the testis. Though it will look as big as this, but you're not going to be able to palpate the testis. Okay, in here you can palpate both testes. Obviously, it is worse on the left side compared to the right side. And you can see you're having some, obviously, what looks like swellings, which are likely to be epididymis. Thank you.